So, good afternoon, everybody. I would like to welcome you to this session together with John Amoasi, who is the leader of the research group Global Health and Infectious Diseases at the Kumasi Center for Collaborative Research in Ghana. The session has the title Research Cooperations for Improving Global Health, and we want to talk about best practice models of sustainable Africa-Europe research partnerships. The co-host of this session is the Leibniz Association, one of the large research associations in Germany with 96 institutions of different disciplines. There's a number of long-standing research collaborations of Leibniz institutes with institutions from sub-Saharan Africa. Against this background, the partners are determined to work together strategically and in the long term to develop a common vision for relations in science and in a globalized world. There is no doubt that research partnerships between institutions in sub-Saharan Africa and Europe are essential for sharing knowledge, building capacities, and focusing on the major burdens of infectious diseases and threats to global health. Today, we try to learn from these collaborations and want to find out how can sustainable research partnerships be achieved? What are the expectations and the best models for this kind of research partnerships? And how do local partnerships integrate into the regional health strategy of Africa? These are the questions that we want to discuss with 5 speakers of different African institutions who will give us a very short impulse talk on best practice models of sustainable partnerships, of their positive and negative experiences. The first speaker, however, is from Germany. Veronika von Messling is the head of the Department of Life Sciences at the German Federal Ministry of Education and Research, and I'm very happy that Professor von Messling will give a keynote on the view of the ministry on this topic. And yeah, thank you that you are here.
Actually, the pleasure is mine because these networks are one of our signature programs, and I'm really, really delighted that we have this session here, and I'm honored to speak in this group. So, dear Professor Mai and Amoasi, dear esteemed speakers, dear ladies and gentlemen, I've recently learned about the African proverb, when spiderwebs unite, they can tie up a lion. This is not only a beautiful analogy, but also exactly what we need to do worldwide. Unite our efforts to tackle the enormous challenge of achieving global health as part of the United Nations Sustainable Development Goals. When we talk about what research networks need to make a difference, there are 2 main topics I would like to consider. First, the environment research networks need to create for themselves. And second, the setting they need to be successful. And of course, this is not just true for African European networks, but for all research networks and collaborations. Concerning the first topic, the environment they need to create. I am sure we all agree that improving global health needs research and innovation. Skilled health scientists gathering solid data and providing evidence. Excellent research results lead to science-based assessments and subsequently to recommendations for decision-making and to innovations for better healthcare. Scientists working together in collaborations, networks, and initiatives are in the best position to be heard, and they can achieve a lot. They not only have the potential to shed light on infectious and non-infectious diseases, to discover new pathogens, track their evolution, and expose their weaknesses, and thus unravel the facts we need, but they can also change the way we think about a disease. When welcoming other vital actors into the partnerships, such as social scientists and the civil society, they can benefit from valuable indigenous knowledge and also become strong enough to understand and change behavior, where it helps to contain the spread of pathogens or the development of a minor to a serious non-infectious condition, and thus prevent a high burden of disease. When including the pharmaceutical industry, they can help develop tests drugs, and vaccines, and thus not only present facts, but solutions, as well as to discover disease prevalence, treat patients, and prevent infection. And when introducing national and regional health strategies, when networking not only with scientists, doctors, and communities, but also with policymakers and other stakeholders, they improve the chances that their research results will be translated into policy and practice, and that their efforts will reach people and improve their health. So ultimately have impact. And that, I think, is what we actually ultimately strive for. Let me illustrate the theory with an example. There's a European research infrastructure consortium called LifeWatch ERIC. They coined a concept for this still needed cultural change from working in silos to working in complex partnerships, and call it moving away from a single core brain or brainetics to a high performance brain network or brainomics. Yet besides excellent research, besides the right partners from all relevant fields, and besides adopting a change mentality such as brainomics, networks need to invest in infrastructure and include young scientists to be sustainable. We all need to harness that young energy, that drive, and believe that we can actually do better. That urge of wanting to shape the world into a healthy community that includes animals and the environment, that desire to actually make a difference. When research collaborations then have done all that to provide the environment they need for themselves, when they have included the experts across disciplines, the biologists, medical doctors, social scientists, the civil society, the industry, decision makers, and young scientists, is that actually enough to make a difference? What about the second topic, the setting they need to be given to be successful? This is, I guess, where the funders come in. So how can funders help? Of course, funders provide fund. I mean, that's pretty easy. But as important as funds are, there are other vital needs, such as flexibility and empowerment. Funders can provide the right setting for networks to be in the best possible position to be heard and to excel. They can provide funds with necessary flexibility, and believe me, that's extremely difficult. They can provide funds for what is truly needed locally and for what the collaboration sets apart from others and make it achieve ambitious goals globally. In terms of empowerment, funders can support researchers to build a communication network with local decision makers. We as funders can try to provide the best possible platform to bring science and policies together. And if this framework is built, research networks will not only contribute to achieving SDG 3, good health and well-being for all, but to almost all goals depending on their research. Yet at least 6 further sustainable development goals will be addressed by most healthcare networks. Goal 4, which is education. Goal 8, decent work and economic growth. Goal 9, industry, innovation and infrastructure. Goal 10, reduced inequalities. Goal 16, peace, justice and strong institutions. And goal 17, partnership for the goals. The knowledge about the importance of partnerships and networks has long become universal. And when spinning a web with united efforts that is strong, diverse, and flexible, we can tie up that lion. The following speakers will give us an interesting insight into best practice models of collaboration about COVID-19, tuberculosis, malaria, AIDS, and Lassa fever. They will sharpen our understanding of best established partnerships to align our efforts with national and regional strategies and improve the health for all humans. Thank you, dear Professors May and Amouassi, for giving me the opportunity to open this workshop as a basis for discussing chances and perspectives. And thank you to the audience for your attention.
Thank you very much for this view from the ministry. We have time after the impulse statements to ask questions from the auditorium, also virtually via chat. So we come to the next speaker, who is Professor Richard Phillips from the Kumasi Center for Collaborative Research. He's director of this institution, and this is one of the two large biomedical research institutes in Ghana, and this has a long partnership with the Bernard Nocht Institute for Tropical Medicine. Richard, thank you.
Thank you. Thank you, Jürgen. I'm pleased to do this presentation on KCCR and our role with COVID and the impact of the partnership we've had with Germany over the years. Partnership is always about capacity building, mutual two-way knowledge flow between partners, and shared decision making, and looking at mutual benefits in the long term. And when this goes on for a long time, you end up having sustainable partnership. We know the older model of the unidirectional type, but here we are talking about a two-way flow in knowledge, capacity, and decision making. And I'll look at the example of the center, Kumasi Center for Collaborative Research, how it was set up and structured, and some of the lessons that we can draw from this relationship or partnership. So the Kumasi Center for Collaborative Research was set up as a joint venture between the Bernard Nocht Institute of Tropical Medicine and the Kumasi and the Kwame Nkrumah University of Science and Technology, which is a big university in the middle belt of Ghana, together with the Ministry of Health. And this is a unique partnership because here you have, it was sealed or ratified in a state agreement between the German government and also the government of Ghana. And also when you come to Ghana, it's the collaboration is between two different ministries, the Ministry of Education and the Ministry of Health. So that made the arrangement very unique. And one of the important things is that there were clear roles and responsibilities set up for the partnership. And it's 24 years old now. And until COVID came, many did not realize that the center had made so much progress. And indeed, several research groups have come up in this center. PhD have been made, several PhDs and master's students, and several research groups have come up and has provided the sort of platform with equipment needed for research. And in 2020, when the COVID pandemic broke out, it was interesting because some of the scientists that have been trained had strong links with Germany and with Bernard Nocht Institute and also with Charité. And so they quickly got the reagents in to establish the testing because they had already been doing testing and looking at coronaviruses in the Ashanti region where we were. And immediately testing was set up together with the other research center in Accra, and testing for COVID was set up. And interestingly, it wasn't long after that the borders were all closed down and you couldn't move to partner African states or you couldn't travel abroad. And so we're all to ourselves, we had to manage the pandemic. And interestingly, it was these scientists that drove the testing in the country. And indeed, it made the center really popular. And we had a visit from the president in May of 2020. And that was highly laudable and was a great motivation to the center. And so we see that the center had facilities for testing, for molecular testing. That wasn't easily available. And the two research centers, unlike most of the public health facilities, did not have molecular testing available. And so they had to shoulder the testing and keep it going for the center. We needed to introduce innovation, and that was done locally because of the capacity that had been built over time, over 24 years. And also data sharing, we already had data on coronaviruses and the spread in the area, and we shared that data. And also some of the scientists were on the national media educating the population on coronaviruses and what to do and how to stay safe with the disease. And so having said all this, there was a lot of opportunity to work with several other players. And these include the Ghana Health Service and the Ministry of Health. There was the opportunity to work with other research centers. There was the opportunity to work with WHO and other international partners. This was a huge opportunity for KCCR. There were difficulties, and I have to talk about this as well, that it was at that time that it dawned on me that really capacity in country was very limited and in Africa, because we needed quickly to train people across the country and set up other laboratories for molecular testing. That wasn't immediately available. And we didn't anticipate this several years before. And the ministry also realized that there was a deficit in infrastructure. But quickly we teamed up and they got us to train a number of the labs to also start testing. And currently there are over 40 testing centers in Ghana because of the partnership between the two research institutions to do that training at the local level. In terms of supplies, there were deficits in supplies. No supplies were coming in. Biosafety cabinets were not immediately available, and orders took sometimes up to 6 months to get orders coming in. And the other thing was the lack of capacity at the various institutions. It all came live with the COVID. And at that time too, funding was an issue. And so the government had to provide the resources for us to be able to do the testing. There are several lessons that I learned out of this. And one of them is the fact that we can no longer work in silos. We can no longer work alone. We need to work with other partners. We need to work with the governments. We need to work with the research centers. We need to work with international organizations. We need to work with different players, including One Health, the veterinary department, because they also were very instrumental in the testing. And so for me, that's the way forward, thinking about how to work with people. Even though we've established all this capacity, we cannot work alone. So that is my submission for the current moment. I'm sure I'll come back later. Thank you.
Thank you very much, Richard, for this perspective, and also not to leave out the challenges of such an endeavor. The next speaker is Marilyn Glassens. Professor Marilyn Glassens is an associate research professor at the University of Namibia and a trained physician and epidemiologist. And she will report also about a long-lasting collaboration with another Leibniz Institute, the Research Center Borstel, on tuberculosis research.
Thank you very much, and thank you very much for this opportunity. So there are two things that I want to mention here, which I find crucial to a successful research collaboration, and which we at the University of Namibia are lucky enough to have with the Research Center Borstel here in Germany. The first one is that the partnership must be equal and equitable. So what does that mean? Both groups must benefit, but the group who has less to start with must benefit more. So for instance, in our partnership with Borstel, we gain support for staff, skills and other capacity building, infrastructure support, laboratory setup, and the list goes on. Borstel gets some samples from Namibia to sequence, and they support us in writing up the results. But they already have everything else on the list that I've mentioned. So in a sense, it's impossible for us from Namibia to bring exactly the same cards to the negotiating table. Hopefully it will become more so more possible in a few years from now as our collaboration and our equitability grows. The other aspect that I want to mention is local capacity building. And here it is important for the stronger partner, in this sense, meaning the partner with more resources, to realize that the collaboration is a long-term commitment. that the weaker partner is not becoming a satellite of the stronger partner, but rather an entity in its own right, and that the power balance should not determine the terms of engagement. In our setting, for instance, we now have 8 PhD students starting with their doctoral projects. All of these are nested within our research studies, which we do in collaboration with Research Centre Borstel. All of these students are Namibian, all are women. We have to deliberately choose to empower more women in our capacity building strategy, since there's an attrition amongst female graduates as they move up the academic ladder, similar to many other places in the world. This capacity building component is crucial for sustainability and for progress in the research realm. We have seen in the last 10 years only 7 publications from Namibia on clinical trials in infectious diseases. None had first or last authors coming from Namibia. This has to change, and we have to change it together with our collaborators. Our collaboration with Borstel in tuberculosis research has incorporated both these aspects, and by focusing on TB, a disease with a very high incidence in Namibia, in conjunction with a high HIV prevalence, we believe we can and are together truly making a difference in the Namibian context. We will continue with our work, although now amidst the COVID pandemic, it is increasingly difficult to ensure that much needed resources are not rather used in the COVID response. For instance, in Namibia, we have only diagnosed 25% of estimated drug-resistant TB cases in 2020. Of these, we know some are already extensively drug-resistant against the newest drugs, including bedaquiline and linezolid. We must therefore strengthen our efforts, working with Research Centre Borstel and the National TB and Leprosy Programme to find and treat our TB patients early and effectively. I want to close with a quote from Lao Tzu, who said a leader is best when people barely knows he exists. When his work is done, his aim fulfilled, they will say, we did it ourselves. I want to adapt this quote a little bit to make it gender nuanced and applicable to collaboration. A collaborating partner is best when people barely know she exists. When her work is done, her aim fulfilled, they will say, we did it ourselves. Thank you very much.
Thank you very much. The next speaker is Professor Ghislain Mombo Ngoma, and he is head of the research group Drug Therapies at the Centre de Recherche Médicale de Lambaréné. And this professorship is a partnership between CERMEL in Lambaréné and the Bernhard Nocht Institute for Tropical Medicine in Hamburg.
Thank you very much, Jürgen. Thank you for giving me the opportunity to present our research center here at this summit. Actually, CERMEL stands for Centre de Recherche Médicale de Lambaréné. It is in French. French is our language, official language in Gabon. So CERMEL is actually within the facilities of the Albert Schweitzer Hospital. Albert Schweitzer Hospital comes from Albert Schweitzer, who came actually from Germany, founded a hospital in Gabon in the year 1913. And from that hospital, of course, there have been a lot of activities that were useful and helpful for the local population. He got the Nobel Prize, I think the year 1957, something like that. Then afterwards, within the hospital, there has been a research center or research unit that was founded around the year 1982. And that was first in a collaboration between Bernhard Nocht and Lambaréné, and then A few years later, it was taken under the leadership of Professor Peter Kremsner, who is from the University of Tübingen. And now there is again the collaboration established with Bernard Nocht, with the leadership of former director Egbert Tanisch, and now with that of Jürgen May, but as well with Michael Ramate, who was before at the University of Vienna and now is here at Bernard Nocht. So the activities at SOMEL are mainly around the research for the local diseases, mainly tropical diseases, and the main one has been malaria. So we have established expertise in the development of drugs for malaria. So the main drugs that are currently used have been assessed in Lambaréné. At the moment we use the ACTs. It is a concept that actually our groups have worked in collaboration with the different groups. The link with Germany is that SOMEL is based in Gabon, but doesn't have any co-funding from the government of Gabon. We do have the land, we do have the buildings that were given by Gabon, but the SOMEL functions with the budget of the different projects, but mainly the collaboration that we do have with the different institutions in Germany, and the calls that we have, we do partner with our partners here in Germany, and these calls are funded mainly by through the BMBF with the GIZ, the DFG, and all these other things, but as well EDCTP. And the center is very well now recognized by the pharmaceutical companies developing compounds for malaria. Like a few years ago, we had the visit of Vas, who is now the CEO of Novartis, and he was very much impressed by our facility, that since then, any new compound of Novartis, which is being developed, is actually assessed in Lambaréné. At the moment, we are assessing all the new compounds like cipargamine, KAE 609, and so on. So this position with the leading position with the doing research has made us as well establish something for training. So that makes that with the collaboration with the German institutions, we do have, we receive every year a lot of German students who come to develop projects for their dissertation, for medical thesis, and so on. But as well, in exchange, we do have as well Gabonese, but not only Gabonese, African scientists who are working at SOMEL, but are as well trained here in Germany from the different programs, masters and PhDs, and so on. And the individual capacity building is as well very well actually strengthened throughout the concept that came from Tübingen, from Peter Kremsner, that I've already mentioned, because now we do have two professorships. One is in at Tübingen. There is a colleague professor from Tübingen who is actually based in Gabon. And there is another professorship from Bernard Nocht, which is the one I'm holding, and based as well in Lambaréné. This is, I think, one of the first models of this kind that is very well strengthening the capacity building at the individual level, but as well at the institutional level. I will stop there and just say, at least from what Richard has said in terms of KCCR, this is as well what has happened for SOMEL. We were at the center of the COVID-19 activities, linked very well with the government, and this was a very good acknowledgement. So I will stop there and come back when there is the discussion. Thank you.
Thank you very much, Ghislain, for this view from Gabon. And we change back to West Africa, Professor Silvanus Ogogbenin is the next speaker, and he is Chief Medical Director of the Ruhr Specialist Teaching Hospital in Nigeria. And this is an area where Lassa fever is endemic, and this is exactly his research topic, or one of his research topics.
Thank you. Thank you, Jürgen. First, I'm very happy to be here to talk about our collaboration with the Bernard Knott Institute of Tropical Medicine. This is a collaboration that has been on for at least 15 years, and I think it's made a lot of impact on the ground, and that's why I'm happy to talk about it today. Before the collaboration, Lassa fever had been in existence for over 50 years, and we just sent samples outside the country to get diagnosis done. But when the collaboration started about 2008, one of the strongest things that happened was that laboratory facilities were brought on site. And so we started to do our diagnosis on site, and that was very positive for us and very positive for the country. And it continued like that. By 2018, we had sufficient data to show that the prevalence of Lassa fever was a major concern. And from 2018, because of our collaboration and the data that had come out, Lassa fever was moved from a neglected disease into a disease that was prioritized by WHO for research and developmental blueprint. So for me, that was one great gain, to be moved away from a disease that was completely neglected for research for over 50 years to now be prioritized for vaccine development, for new therapeutics. I think it was one of the great gains of the collaboration. And from there on, the government bought into the collaboration. We now have a national Lassa fever consortium, which I chair. And with that, we are able to do a lot more research, and more bodies have come to assist in the research. So we're now working with CEPI in one of the biggest research in West Africa, looking at the epidemiology of Lassa fever. FIND is also on the ground, helping us build up more diagnostics and biobanking. So from the humble beginning in over 15 years, Lassa fever has moved from a neglected disease to a disease that's prioritized. And I think that's one of the great gains that we have had. And one of the ways we achieved this collaboration was first the setting up of the laboratory. It was not just for research, but also for services. And that's one thing I think collaboration should do. Collaboration, yes, for research, but it should also provide services on the ground. That helps a lot, because the immediate gains that people on the ground want to see is that services are provided, rather than just thinking that you're coming to collect blood for research and they can't see the immediate gains. But with the diagnosis on the ground, the next thing we did was to build up case management. And because it's a teaching hospital, there were a lot of consultants on ground who leverage on the fact that they can now make accurate diagnosis to build up case management. And with the building up of case management, mortality from Lassa fever began to drop considerably. From over 40%, it dropped to less than 10% in our institution in the last few years. And that was a major gain. In fact, it will please you to know that before the collaboration, we had deaths from healthcare workers on a yearly basis from Lassa fever. But since 2008 to date, there's been no death from any health worker working in Ruhr Specialist Teaching Hospital. And I think that's because we are able to make early diagnosis, and now we are able to commence treatment early. I think that's some big gains we have made. Also, we developed the ethics in the institution. In Nigeria, our institution has one of the best ethics committee, because once you begin to do research, and I think it's one thing we all have to do very well when we go to places to collaborate, build up the ethics also. Ethics ensures a lot of things. One, the community, they are reassured about the research you're doing. The physicians, the doctors, the scientists are reassured, and then the ethics too of the country, they are reassured. And therefore, whatever you come out with, it's easy to talk to policymakers so that they can implement some of the decisions that you have come to do. Then crisis. Sometimes you have crisis. Collaborations should also assist in resolving crisis. Sometimes we had yellow fever outbreaks, and we just come in because you have to give your collaboration and the work that you do some visibility. So when there's a yellow fever outbreak, we try to go to the sites and ask to assist, and we make diagnoses based on the PCR machines that our collaborations have brought to us. And once you're able to help make diagnosis, you bring visibility, you bring recognition, and you bring support for the programs that you're doing. And we have done this very well with Inira Specialist Teaching Hospital. Also, like some of my panelists have mentioned, have talked about, during the COVID crisis, the collaboration with Benacnoct was also very visible to government and to the community. We were able to leverage on the fact that a lot of personnel had been trained, and they've been trained in such a robust manner that they can work independently. And so they were able to assist many other states in the country set up their own laboratory PCR molecular diagnosis. So from a conservative 4 laboratories that could do PCR at the commencement of no COVID, as at the last count, over 100 labs can do COVID molecular diagnosis, and all this are from some of the from the collaborations we had with Benacnoct Institute. We were also able to carry out sequencing on the site, I think in 2019, and that for us was also a new knowledge and new skill that was brought to the collaboration. And the sequencing was able to help us implement some decisions. There was a sudden increase in the total number of Lassa fever cases that we were getting. And the sequencing helped us tell that, look, the virus has not changed. It's still mainly from rats to humans. And so efforts were focused now on preventing rats to human transmission, because the human to human transmission was a lot less than was previously thought about. And the virus had not changed, and that helped in the intervention. So I think some of the things that we have gained is looking at, in collaborating with Benacnoct Institute, is when you want to collaborate, look at it as a long-term issue, not one research issue and then it ends. When you look at it as a long-term issue, then you're likely to build up the infrastructure. In this case, the laboratory infrastructure was very important. It's been confirmed that early diagnosis helps to save lives. So building up on the laboratory infrastructure, training the personnel in such a robust manner that they can, that it goes with mentorship. So it's not just training and then they are left to do their thing. But when training is associated with mentorship, then they can take ownership, they can act with very little supervision, and they can make initiatives. I think this also went a lot of way to help establish what we have. Some of the challenges you'll face is the brain drain phenomena. Many of the doctors from my institution and many of the scientists are moving to countries where they pay more. A lot are going to Saudi Arabia, some are going to Europe, some are going to America. And that's been a major challenge on sustainability and the next generation of people to continue the work. So we're trying to look at ways of addressing that. And then I think it's also important that we provide enough incentives for people to take research as their career path, and that can help also in limiting the brain drain phenomena. If people are incentivized enough to take this as career paths, then they're more likely to stay behind, see the successes and see the usefulness of the work, and that will make them be more interested and stay put in doing the work. I think I'll stop for now. Thank you very much.
Very much, Silvanus, for giving us insight in your work on this one health relevant disease, and especially for to raise the important issue that research in these endemic countries cannot be separated from service and capacity building. I think this is also true for all the other institutions, but this can maybe be discussed later. Last speaker is from South Africa, and he speaks also from South Africa, from Durban, I think. Professor Tumbindung is the Deputy Director of Max Planck Research Group at the AHRI in Durban, and this is a collaboration with the Leibniz Institute for Experimental Virology, former Heinrich Pette Institute.
Thank you very much, Jürgen. I hope that you can hear me. And my apologies that I couldn't make it to Berlin, but nevertheless, I'm delighted to participate in this discussion. I work at the Africa Health Research Institute in Durban, South Africa. For those that may not be aware, South Africa is the epicenter of the HIV/AIDS epidemic. In a recent survey that we did in our local population, HIV prevalence in the general population approached 60% in women and about 35% in men in the neighborhood in which we work. So it's extremely high level of HIV. And I think what we have learned from our collaboration, first and foremost, is that for these partnerships to work and for them to be productive, you need to have a long-term vision, like some of my of the earlier speakers have mentioned. I think it's very important to have a long-term vision because sustainability, for the programs to be sustainable, you cannot really think about it overnight. You're not going to be able to develop capacity overnight, and you're not going to be able to develop systems overnight. And so you need to have a long-term vision, but you also need to have local leadership. And I think that's very, very important to have local leadership. African-led research is really important because that's the way to create sustainability and to ensure that once you have started an initiative, that it will go long into the future. And I was very privileged myself, first of all, to receive funding from the Max Planck Institute, and for them to allow me to work in Durban, South Africa, which is the epicenter of the HIV/AIDS epidemic. So there is no better place really to do research on HIV if you want to really work on HIV and tuberculosis, because we are right at the center of these problems. And the kind of access that we can get to participants and to their needs, to understand their needs and to understand the research questions that are relevant to the local population, you really need to be in a setting where the problem is. And so that has really been a very important part of our collaborative work, both with the Max Planck, but also with the Leibniz Institute through our work with colleagues there. And I think then the other thing that I would like to mention is that it's not important just to capacitate individuals, but I think it is also very important to build strong local institutions. So when you're thinking about these partnerships, there needs to be an understanding that you are not only building individuals and individual researchers so that they can become good researchers and be able to produce research that will be innovative and lead to either new products or to new policy, but you also need to build institutions, because it is the institutions that will sustain the individuals. So the research ecosystems that people work in developing countries in particular, is very important that those ones are built. And this is not just for Africa, of course. It's an issue that is relevant everywhere globally. But I think sometimes that when we have these collaborations between low or middle income countries and high income countries, people tend to forget that it takes a lot of effort to build strong institutions. And so I think for sustainability, it's also important that as you build capacity for individuals, that you also realize that there's a component of institution building. And this, in my view, for you to have a good research ecosystem, there are two main components that are very necessary. One is research management needs to be strengthened. So you're not only supporting researchers so that they can gain technical skills, but you are also strengthening research managers so that they can oversee the grants and they can see all the other components that are important in research management. In addition to that, of course, is the issue of infrastructure development, because of course you cannot run a strong research institution and a sustainable research institution if you are not building the infrastructure in terms of buildings, physical facilities, as well as the equipment to enable people to do their work. And then finally, I just wanted to mention the component of scientific citizenship, because I think it's also very important. It's very important that people be capacitated also for scientific citizenship. And in fact, there is no better person to have a strong scientific citizenship program other than the local people, because the local people know the policymakers, they know the people in government, and they can help a program, a collaborative program, engage with the key stakeholders, whether it's from the community, whether it's from government, whether it's from media, in order to ensure that the program becomes sustainable. So I think I'll stop there for now, and just say that this partnerships very important, and we need to sustain them over and have a long-term view of them. Thank you very much.
Well, thank you very much to Veronica, Richard, Marilyn, Ghislain, Sylvanus, and Tumbi for those talks on your collaborations. It's quite a lot to drink in, and it's really exciting to see how far all these collaborations have come, and to test the strength of these collaborations through the epidemic, I think is once in a lifetime opportunity. And it sounds to me like each of these collaborations have really made a significant contribution, and without their presence, things would have been a lot more difficult. And I just want to focus in on some of the points that each of you raised, and then ask a few questions, and then hopefully turn it over to the audience as well. So I'm going to start with a point that Professor Messling, you raised. And you talked about how you gave the African proverb that there's a bunch of spider webs can't tie up a lion. Yes, no, it's a good one. It's a good one. But the question is, I mean, are we actually tying up the lion? And you actually alluded to that yourself, in the sense that some have argued, and I was in a meeting last week where a senior person at the WHO was actually questioning whether a lot of these networks and partnerships are actually giving us enough bang for the buck. I mean, is it worth the money on the table? Are we getting as much out of it? So my question would be, are we actually tying up the line? We can. The spider webs are there, but to what degree are we actually maximizing all that we possibly could out of these networks and partnerships that we have? Or are we falling short? Of course, I know we would say we can always do better, but really empirical evidence, can you suggest, I just wanted to just discuss this briefly.
Let me see here. I think you're raising a very valid point. And I think this is one of the questions we have to ask each other way more often. So I guess what we are realizing with, we also have lots of networks within Germany. And I think what first of all, it is always good to work together. But the expectation, first of all, the goal has to be defined. What do we actually want to achieve? Who do we need around the table to achieve this goal? And then how do we succeed in making sure the sum is more than all the pieces, you know? And I think that's what you were saying. And this is, the questions are the right questions. how do we actually follow up? I think classically it's evaluations and reviews. I think it is also an important element is to have funding rounds, have a beginning and an end, and then an evaluation and a decision on how to continue, or if it is worthwhile continuing, or if something has to change. I think these discussions are always incredibly painful because people put their heart into these things, and it's never, or it's very rare that it is completely black or white. There's always shades of gray. So I think but it is very important to have these discussions and to ask these questions. And I liked what was said about partners don't have to be equal partners in terms of what they contribute, but they have to contribute parts that are needed to succeed. So then it's a partnership. If everyone brings something to the table, it doesn't have to be the same money's worth or the same amount of time or effort, but it is something that the others need, and so that the sum is actually getting there. And I think that's also an expectation and an opportunity. So it's exactly what was said in the beginning. It's not about like giving something. It is about exchanging something, exchanging experience, exchanging learning opportunities or training opportunities, all of that. And I think that's what we have to look for if we want this to be successful, if we want to get that lion. And we have to actually say which one is the lion. Otherwise we tie up anything that moves.
No, that's a really good one. And I'd like to come to you, Professor Phillips. Still along the same lines, and we've all had to write reports for funders and for partners where they ask you to evaluate and demonstrate that you delivered on what you said you would deliver. And sometimes the partners or the funders will question, but you have funding from XYZ, and so this is not really an output of my funding. So can you show me exactly what my funding did? We've all been in those kinds of situations before. I was recently in a situation just like that. And I had to explain clearly that, well, you cannot really extricate and say that, oh, your money did this, because it's built on a platform. Somebody did something. That's why you were also able to come and do what you are doing. But Prof. Phillips, how do you suggest that as partnerships, we can demonstrate the direct impact of activity, at the same time recognizing that it's part of a system, and so you cannot really divorce it entirely, and yet be convincing enough to show that this works and we should continue?
Well, that's it's a difficult question, to answer, but we need to try to answer that, because there has to be a way of measuring progress, and that is one of the key issues with knowing how much capacity we are building over the continent. There are lots of publications coming out that most of the capacity we are building is currently located in 3 countries in Africa, in South Africa, maybe in Egypt, and just a few countries, distribution uneven. But we need to have systems to be able to measure this kind of progress. It's not so easy to quantify or to put numbers to that. But what we know is that still there's so much. There was one publication that said we need 1 million more PhDs to be able to cope with the numbers that are moving out into Europe. But we need to have a way of measuring that. Maybe through the networks, we should have a way of measuring how much progress we are making, especially with the capacity that we are building. But at least the numbers and the general observation is that we are still not there, but we need a system that can actually measure that.
No, thanks for that. And I know some people have developed some metrics for measuring the impact of partnerships and funding and this kind of thing. It could be helpful, but it just shows the complexity of being able to demonstrate how these partnerships and relationships really deliver what we say they do. I'd like to move on to you, Professor Glassens. You made a point which Prof. Phillips also made around, equity and equality, and Prof. Phillips made mention of shared decision making. And you also were very specific and made mention of deliberately choosing to empower women and issues around first authorship and so on. I think these are really important points that you raise, but also they raise challenges. And I'd like to ask you how we can address some of these. For example, last week I had to deal with a situation where a female colleague, former student of mine, who said she wanted to pursue a career in research. And she was a really good student. And I said, I'll support you any way I can. She's not even in my city. She's in Accra. Jürgen, you met her in Accra when you visited. And so I employed her fully with the intent of sponsoring her to do a master's, hopefully a PhD. She's a medical doctor. Only last week, she scheduled a call with me and said that she cannot continue working anymore. Why? She's had one baby. She's pregnant with the next. She lives far away from the research site. It's putting a strain on her marriage and her family. And she thinks she has to just go back and be a regular doctor. I was very disappointed, but I could understand because I happen to have a wife who is also a doctor. So I understood what it meant, but I tried my best. It just didn't work. And then also the issue of first authorship. When the idea would come from, say, the partner in Germany, when the money would come from Germany, and then maybe partners in Africa would deal with the coordination and the field work. And even that sometimes colleagues from Germany will come and do that also. How easy is it to make the argument that there must be first authorship and last authorship? Should it be a token or should it be earned? So it's quite a lot I've asked you, but just around these issues of equity and making things work.
Thank you very much. Difficult questions today.
Yeah.
And I just want to put it on the table that I'm also a mother of 3 kids. They are 3, 5, and 7. They're alone at home with their father, who's a spinal surgeon. So it's going hectic. So I think what we really have to do at this point in time is to start thinking very much out of the box, to realize that what women are doing every day is a job. When they're at home, it's not just looking after kids. There is value in that. And we have to realize that we have to work around it to ensure that we actually empower these women to be able to have academic careers as well. So there are interesting things coming up, you know, like breastfeeding rooms at work, creches at work, being able to bring your nanny to your work situation. And I'm just mentioning a few. There are lots of other things that one can do, but you actually have to take the first step, and the men in the room have to take that step with the woman to be able to think out of the box and to bring these changes around. So I think that's with regards to women in academia, but I agree it's extremely challenging. And if we don't start thinking about it differently, I think when we had the Forum of Gender Equality earlier this year, and we compared to what has been happening in the last 26 years since the forum was in Beijing 26 years ago, not a lot has changed. And we really have to push that as women, but also as the men in the room. So that's the first point. On the second point of authorship, I don't think it should be a token, because I don't believe that's the way of capacity building, especially local capacity building. I think what should happen is that there should be enough in the partnership between the local institution and the institution elsewhere, in this case, Germany, that primary first authors are being empowered in such a way that they do actually come up with the ideas, that they are trained enough that they can actually write the papers after they've actually implemented the projects themselves. I do see there's an in-between step between first authorship maybe coming from the local institution and senior authorship coming from the overseas or the other collaborating partner. But as we move in the process of empowering more and more local individuals, they will in the end also be in a place where they will become the senior authors, not as token authors, but as real scientists in their own right. So it's a long-term process. It's not going to happen overnight, but it is possible.
No, thanks for that, really. And I'm totally sold out with your proposition that we need to be very deliberate about making the research environment, particularly in partnerships, work for women. I'm yet to see a grant funding call that makes specific provisions to allow women to thrive with things that you're talking about, breastfeeding rooms, bringing the nanny along. Maybe if I had these at the research field in Accra, my student would have stayed, but it just didn't happen for me. But I agree, we need to be very deliberate. It would be a paradigm shift, but something really challenging. Professor Mombo Ngoma, I want to come to you. You raised a number of very interesting things. And in particular, you talked about no core funding coming from the government to CERMEL. And so that means that all the money is coming from the grants and the partnerships with Germany and so on. So I'd like to ask you, what is CERMEL doing to attract direct funding or support from the government, maybe by way of even salaries and a bunch of other things? I know provision of the land and all that was done, that's fine. But are there any deliberate efforts? Because the truth is, funding goes with ownership. And once the step is taken, it will be a further improvement of the equity, which Marilyn made mention of.
Thank you, John. Yes, this is first, this is a fact. This is something that exists. I have to confess that there have been a lot of discussions, and there are ongoing discussions to try to identify where these core funding can come from. But for the moment, this is a fact that we've not reached that point yet. Nevertheless, this is not really an obstacle to what we have been doing. And maybe one thing is to say that although we don't have that core funding from the local government, but maybe there are a lot of in-kind contribution that maybe is not very well evaluated or estimated, I would say, like for the electricity and so on, the water. I have to admit that this is something that is given as well, supported by the government. It's just that it's not really estimated, and sometimes, but this has to be acknowledged that it is a very good contribution as well. But if you allow me, by the time I'm responding, I would like, because it is as well, we have to share as well the experience of our different sites while we're talking here. I want to touch a little bit on this point with the authorship and the women in science, particularly those coming from Africa. I have to say that I pleased to share the experience of what we are doing in Gabon. Myself, I'm in my working group, I do have a lot of women, and most of the time what I do is anytime I attend meetings or I present my colleagues, I'm very proud of showing that we at CERMEL, we are promoting actually women in science and building their capacity. So this is kind of becoming one of our mottos besides our research and everyday activity. And within the institution, we are as well, it's not perfect, but we are trying to develop different procedures and processes that can encourage and keep the women. But by the way, the same experience that you've been mentioning is something that's I'm experiencing at the moment. One of the colleagues I'm counting on, who is a lady, is unfortunately leaving because of the same conditions that you have mentioned. But nevertheless, we continue to encourage a lot of women. In terms of authorship, I have to share as well the experience that myself, I've been a group leader I have to say first that my experience at BNI is quite recent, so I will be talking more of the experience with the Tübingen. So I've been a group leader for many years now, and my colleagues, Professor Denika and Maxima Nyanji as well, who are Africans, have been as well group leaders before me. This is something that was empowering the local researchers, local scientists, and as group leaders, we had to define our own agenda in terms of the direction of giving the research, and then we had just then to apply with the other colleagues for the grants that we needed. So it's a model that I think it works. We don't suffer a lot for the lack of core funding. It will be good if it comes, but I have to say that each research group has enough funding because we've secured that, and because as well our own agenda was very well established. Thank you.
Well, thank you very much, Ghislaine. So this also allows for the flexibility of funds, which Prof. Messling made mention of, which I can also identify as a group leader myself. Very important to have those funds so that when the issues arise, you can quickly design the research to address them. All right, I'd like to come to you, Professor Silvanus. You made mention with regard to your work on Lassa fever about the sending of samples outside the country and how now that capacity has been built at your site, and you can do everything, including our sequencing. Now, as you can see, the questions are rather tough today, but I think these are the realities. So I'm going to, ask another provocative question, and I'd like to ask Jürgen also to respond to that. Sorry to put you on the spot, even though you're my co-chair, but I think it's very important that we hear the thoughts. And it has to do with, well, if the capacity is entirely built in the global south, in Africa, then it's like, okay, you don't need any more partners anymore. You have all the equipment, have the capacity, you set your own questions, answer them, write your papers, and everything is fine. Don't need any more partnership from Germany. So it would be almost a self-destructing mission to empower the colleagues in the south with everything they need, so that now no more samples going to Germany, now no more students coming or going, everything can be done. We don't need you anymore. What I thought, is it true? Is what I'm saying true?
No, that's not the way I'm looking at it. Really, yeah. Before 2007, we had to send samples out. And since 2008, we do all PCR in country. We also talk about South-South collaboration. During the Ebola crisis of 2014-2016, we also had the mobile lab donated by EU through our partners, which we took to Sierra Leone to assist with diagnosis. So we still need the partnerships to not only collaborate North-South, but also South-South. And when Sierra Leone for 2 years, doing the helping out with the diagnosis for Ebola. So the needs are always there. Research is not just the diagnosis and the lab. We talked also about clinical research. Part of what we're doing now, clinical research, trying to find new therapeutics. We are currently doing a pilot on favipiravir for Lassa. Like I said, we've been prioritized. Lassa has been prioritized for research and developmental blueprints, and vaccine trials are in first stage in a few countries. We know that when it comes to phase 2, phase 3, they will have to come to our sites. So the research keeps going. And I think the fact that we can do diagnosis in country gives us the impetus and the leverage to do more and to finally answer the question. I think I'll probably use this to delve into your first questions. Are the lions being tied? There are many lions to tie. And so when you tie one, there's another to tie. For us, the fact that from a neglected disease is now prioritized, you've tied a lion. From the fact that we send samples out before and we do samples in now, you've tied another lion. In terms of training for researchers, many people have been trained. On authorship, I can assure you that many of the authors from the papers that have come from our collaborations, many of the first authors are indigenous scientists, especially when it comes to clinical research. It involves patient care and researches related to them. I have a published paper on Lassa fever in pregnant women coming from our experiences. And this was only possible because we can make definite diagnosis. We have laboratory support, so we can do clinical data. We can take first authorship when we bring up the ideas. And so many of my staff are first author in many of the papers in EID, in Lancet, and in some other journals. So we're happy about the authorship. And if there's need for us to discuss authorship, I think one of the benefits of collaboration with BNI is we sit down and we discuss the issues. We discuss the every issue. If we need to discuss authorship, we discuss them, and then everybody is placed in the right position. So I think that's that.
No, thank you very much, Sylvanus. And later I'll catch you maybe over a cup of coffee to ask you the question. You really believe there's no Lassa fever in Ghana? Because it's quite strange that we don't have any in Ghana and you have it all in Nigeria, but that's not for today. We'll talk about that. But Jürgen, I know you're not on the table, but I reflect over this, the building of capacity in Africa and being able to do everything in-house. I know you are fully committed to this because we talk a lot, but has it ever crossed your mind that, okay, maybe we will not be needed anymore? And
it would be nice if this would be true sometimes, despite the fact that we do capacity building always linked to research. This does not mean, I'm convinced that strengthening capacities for research is also strengthening health systems and also strengthening or developing a country. This is a small part of it, but we are not doing development aid. This is part of our work, and hopefully this is, we hope for a mutual motivation to do research together, as we could do it also with an institution in Europe. So, and if we are on the same level, then it will be better research. And if the diseases are eradicated, then it's fine, and then our work is over, at least in our institute. That's also fine, but this is not what will come soon. But if we work on the same level as much as possible, then it will strengthen our research. And and we always hope that even if the work is done, so if we are really on the same level with the capacities, then there is a mutual interest to collaborate further. And the world is big and there is a lot to do also in other countries. And I don't think in this self-destruction model that you have raised.
Thank you very much.
But it would be nice.
No, thank you very much, Jürgen. So I'll take the quote. When we are at the same level, we can do better research together, just like you collaborate with partners in Europe. I think that's apt and really makes a lot of sense. Prof. Phillips, did you want to come in on that perhaps?
Well, I think that's a very interesting topic. And one thing I realized when COVID came on was that this wasn't going to end. We're not going to tie up the lion that quickly, because it showed that there were no bioinformatics. I mean, people can handle bioinformatics. I mean, the AI technology, we didn't have it modeling. There were deficits in it. There were huge gaps that came out just when we saw that. So I don't think this is going to end any soon. And there still has to continue to be that exchange of ideas with the North and also with the South.
Thank you very much for that. I'm going to go to you, Professor Tumbi, all the way in Durban. Nice place you have in Durban, by the way. You raised a very important point around the administrative support. And it's very interesting, or the research management. When you started out, that's the first point that I made. And then you made the point. So I said, okay, definitely on script. Tell me, how should we go about this? Because we face a challenge whereby in the global north, in Germany and other places, of course, maybe people will be paid a little better in the private sector, but the difference may not be so huge between a research institution in Europe and then maybe a private sector administrative personnel manager. Unlike in the global south, where the difference between a manager and an administrator in the university or in a research institution in terms of remuneration, and that in the private sector, say the banks and the industry, the mining industry, is huge, sometimes more than 10 times the difference. So, and how do we make a case for paying managers and administrators at a certain level so that they can provide the support to free up the researchers to do the work? And I say this because I suffer, and we all suffer under the sheer weight of the administrative duties, which normally as scientists we should not be doing, but we just don't have the men and women with the skills to be able to deliver at our sites in Africa. So what are your concrete suggestions as to how to address this real problem?
Well, thank you very much for that question. I think the first thing we need to realize is to have a holistic approach to capacity building and to partnerships. Again, I'm absolutely convinced that when we're talking about capacity building in low and middle income countries, it's not just about the technical building of people so that they can do sophisticated procedures or research. It's also about supporting the institution building, because people cannot thrive by themselves. It doesn't matter how bright people are. And I feel that in most cases in Africa, in fact, the reason that people don't do well is because they are working in isolation in research institutions that are not well supported. And therefore they falter after a very short period of time. You're going to nurture a critical mass of people in an institution. You absolutely must provide support for the research ecosystem. And I think there's some simple things that can be done. One of the things, for example, would be to consider increasing the kind of indirect support that goes with the research projects. That's one of the simplest things that funders, I've always wondered why funders are not convinced about, because we know that in Africa, research institutions are struggling and they can hardly pay their administrative or research management staff. And yet the amount of money that goes to indirect support overheads, as we call them sometimes, is almost non-existent. And this is in contrast to people in other countries. For example, in other countries, you find that there's a substantial amount, once you get a research grant, that goes to overhead costs or indirect support. This doesn't normally go to African institutions. So African institutions are treated differently, despite the fact that they're the ones in most need. And then I think there needs to be some ring-fencing of money to provide infrastructure and research management support in addition, so that researchers are not thinking of the research project just by itself, but as I said, have a more holistic approach to capacity building, because there's no need of investing money in a research project if you're not gonna think of ways that project can be sustained beyond the life of just that one single project. If our goal is really, in fact, to change the way the world works and to have bigger impact in public health, bigger impact in terms of science and innovation in Africa and in the world, then we must consider these costs and we must account for them, and we must be willing to invest just beyond supporting a single project or a single program of work. So I think there are certain investments like that. And also just to support some of the earlier comments that my colleagues said very quickly regarding issues around, for example, women in science and how we support that. I was the recipient of a grant, for example, recently, that allowed us to give 6-month support of funding to our postdoctoral, female postdoctoral researcher who went on maternity leave. So these kinds of innovative ways of supporting people, so that you realize that in this environment, it's going to be very, very difficult for somebody who is, for example, a female scientist who is very promising to excel if they don't have that extra support. And so we come up with innovative ways to provide ring-fenced money that would support that person, during a transition phase or during a very critical phase in their career. I think those kinds of things we need to consider much more and be flexible with our funding so that we can allow those kinds of situations and that kind of support. It will go a long way to supporting not just individuals or groups, but also institutions.
No, thank you very much for that, Tumbi. I hear you, more indirects. So let's take that home, more indirects. Hopefully it will help us to do a lot more. I want to turn to the audience now and just also ask you for your thoughts and questions over what you've heard from collaborators from Germany and Africa, and any questions, contributions that you may have. The microphones are on the left and on the right. Please, you may queue 2 meters behind each other, as we're supposed to, and ask your question or make your contribution. I know a few of you, so if I think they're not enough, I'll call you out. Please go ahead.
Thank you so much, Chair. I thoroughly enjoyed this session with a Lion's perspective, I would say it is. And it's very nice to hear success stories and challenges that you have faced in building, I would say, starting from a cooperation to collaboration and towards a partnership, and then towards an equitable partnership. So you have these different layers that you have passed through over many decades to have this in a sustainable way. And obviously, many of the speakers were completely right that you need the capacity building, which is key, which is starting from an individual level, let it be an institutional level or an infrastructural or an organizational capacities. And in building these capacities, research cooperation is obviously a key, agree. And what I also see from some colleagues from Namibia, as has been raised with the authorship, this is a very key concern that should be considered by the global diaspora when considering the authorships or first or last authorships in particular, because the data comes from the country per se, but also importantly, these has challenges in building up a sustainable capacity because we are building a next generation leaders for the country. And equally, I would also like to see more in terms of aligning different networks within African setting, because Europe could be an accelerator, but it has to be aligned between different African partners so that the more South-South networking in a sustainable manner would speak and deliver much more in terms of, to the global audience as we speak. And also, it's also I do not, because you have raised a provocative question, why do we need the European partners per se? Because we come up with other multidisciplinary approach. Again, we start with the cooperation. Again, we go into collaboration. Again, we go into a partnership, but at a different level. So thank you very much. My name is Professor Velaban from University of Tübingen, Germany. Thank you.
Thank you very much. Thank you. Please name an institution or where you're coming from and your question or
Yes,
contribution.
Thank you very much. My name is Madalena Lamandake, and I am the liaison officer for medical education issues from IFMSA, which is the International Federation of Medical Students Associations. As a bit of a background about my next question, we are representing around 1.3 million students worldwide, and we work in various areas, out of which they say, not specialty because I'm not at that level, of course, is medical education and research. So my question is actually related more to the capacity building side, because we, of course, are strong advocates of access to research, especially to medical students, because we did in 2018 a global survey, which had, let's say, impressive numbers, such as 97% of the students believe in the importance of research education, but less than 20% of them believe that it is sufficiently addressed in undergraduate medical education. So my question is, we are always trying to build the capacity of students, but we, of course, are students ourselves. So how can students medical association join this spider web that was presented earlier? And how can we get engaged, because we are not always seen? Thank you.
Oh, thank you for that question. Yeah, it's a good one. I was a former executive of IFMSA back in the day when I was a student. So, and I got involved in research when I was still a student, international research, but I'll tell you my story later. I'll push that question to you, Marilyn, and then I'll come on to Prof. Phillips also.
Thanks. I think it's a great question. I can just speak from our experience at the University of Namibia, is that we already engage with research partnerships, if I can call it that, with our medical students when they are pre-graduate. So for instance, I'm a supervisor for 4 different projects of medical students, and they start in their 3rd year of their studies, and they continue with their research project until they're in their 6th year. What we have not managed yet is to get them at a point in their 6th year where they can actually publish their findings, because we are a very young institution and many of the projects that the students engage with are not necessarily seen as proper research, and I'm putting these in air quotes on purpose. What we do now is we try more and more to have the students incorporated in our research projects, which are funded and which have definite outputs and outcomes, so that by the end of their 6th year that they have also at least a publication that they can fall back on, and that they actually know and understand the research process very well. And I think that's a way to ensure that by training and teaching them already when medical students, that they know what it's about, and that you can, in a sense, gauge their interest for research and also foster that interest in research. Yeah.
Thank you. Yes, Richard.
Yeah, just to add to that, the problem is a worldwide problem, at least from in Ghana. That is also a problem for our medical students. Most of them won't see the value of taking an academic career, but they only notice that when they have finished school. The medical curriculum does not often have protected time for research, and that has to be incorporated into the curriculum, the program, so that medical students will have protected time to have some research before they finish school. They do a little bit of research, but not enough research for them to be able to get a publication. And most universities have to think about innovative ways of incorporating this within their curriculum, so that medical students, by the time they finish school, can have a paper at least to make a case for a research career.
Now, you make a very important point, Richard. I remember when I was in medical school, after my BSc, I wanted to go and do a degree actually do a master's in medical research, and then come back to continue medical school. I was strongly discouraged from doing that, and I didn't do it. Just because the environment at the time was completely inimical to that structure or that way of doing things. Anyway, I still got into research. So all is well that ends well. All right, please.
Yeah, hello. So my name is Marilyn. I'm also from Tübingen, and I'm also a co-speaker of the GLORA. And I would also answer to this question from the student side. So we have funded also a focus group in Tübingen for global health, and some students from a group called StudiFam, they're addressed to us and ask us if we would like to share with them curriculum and doing with them some lectures. And so my colleague Carsten Köhler and I agreed, and so this became quite nice. And the students really organized a nice curriculum for the next semester, and we have a lot of speakers, amongst also Gislain, who is there. And so I found it really interesting to work together with them and to share the design of this curriculum. Yeah, and also what I found also interesting, so just very shortly, you addressed this with the pregnant researcher, and I think this is I heard this the first time when I was in a session, so that this is a problem. And in Germany, so we got the parent time in 2007, but it took such a long time. So even fathers can take this time out to look for their children. But on the beginning, they were a little bit, so everybody laughed up there and they said, oh, why you take this? It shouldn't be done. And so, and now it's normal, but this took almost 10 years. And it's a long way, and I think it's good to start now, really to take all the ideas which came up to put this also in capacity building packages. And so,
no, thank you. Thank you very much for that. Our time is up. We just have about a minute. I'd like to read a comment from Gary Aslanyan, who's a TDR on the Q&A session. I read it. Essence on Health Research Initiative of funders provides a number of good practice examples when it comes to direct or indirect costs, equitable partnerships, capacity building, etc. These are available from its website. I suggest colleagues check it, both funders and universities, both in the North and LMIC. So if you go to Essence on the TDR website, you should be able to find information on this. There's also the Research Fairness Initiative by CORED, which also addresses some of these issues that I raised. I'd like to say thank you very much before I hand over to my co-chair, Jürgen, also for final words, to all our panelists for your contributions. As you can see, it's been very wide. A lot of things to consider, but I think they're important issues we need to bring to the table. Some things are difficult discussions. We need to have more of those so that we can make sure that the lion is tied up permanently, put it that way. So over to you, Jürgen.
Yeah, John, this was not planned. The final words belong to you, but yeah, we have 20 seconds to close this session. We have heard and discussed perspectives of Veronika von Messling and the speakers from the different institutions in sub-Saharan Africa on the question how sustainable research cooperations can be achieved. And there were a lot of new perspectives for me, and I have the impression, I hope I'm right, that we are further than 10 years ago, but there's still a lot to do, and I hope we are on the right track. And if we end with the perception that no capacity building has to be done anymore, then this is the success story, and then I hope for further collaborations between all institutions in the world, and that. And we have also to mention that we also need capacity building in the German institutions for many questions.
All right. With that, thank you very much.